and to those individuals from across our Harvard system and residency program who volunteered their time to be here with you today. Special thanks to Mass General Brigham Hospital, Boston Children's Hospital, Cambridge Health Alliance, Massachusetts Eye and Ear, Massachusetts General Hospital, the Plain Hospital, Mount Auburn Hospital, and the Spalding Rehabilitation Center. Over 400 students have registered to participate in today's program, and you represent more than 150 medical schools from across our country. We're also supported by more than 100 faculty, physicians, residents, fellows, staff from across our affiliated hospitals. We're looking forward to robust conversations about your interests and how your interests might align with the opportunities available at Harvard healthcare community. Most important to know is that this day is about you. So please take time to get to know us. During the breakout session, ask questions, ask hard questions. We're ready. No one is here to evaluate you or take notes about your potential candidacy for residency positions. This is really informational and time for you. And so now I'd like to introduce you to Dr. Alden Landry, who's going to be the moderator for today's showcase. He's an assistant dean in our Office for Culture and Community Engagement, an emergency medicine physician at the Beverly Hills Deaconess Medical Center, and associate professor of medicine at Harvard Medical School. Dr. Landry?
Thank you, Joan, for the introduction, and thank you to all of the students for taking time on your Saturday to be here with us and to join us. And a special thank you to all the faculty, trainees, residents, fellows, and all of the staff that are here to support us to have this amazing event. We look forward to a robust discussion and a conversation about the future of medicine, which is you. Again, this is our 12th annual Harvard affiliated residency program showcase, and we're excited to be joining you virtually this time. We will try and cover a broad range of subjects today in our panels, but we recognize that we may not get to all the information that you're looking for during this session. There will be time during our breakout sessions to answer additional questions, and some of which you may not have a chance to ask during the panel. But the breakout sessions are really going to be those opportunities for you to ask specialty-specific questions related to the application process in our residency programs here. Just a few housekeeping notes. We recommend that you set your screen to speaker view so that you can see the members of the panel. This setting is typically found on the top right of your screen if you're using the most updated version of Zoom. Again, while we won't be able to get to all of the questions during the panels, the breakout sessions will be the perfect time to ask additional questions. We ask that you disable any AI bots as it could interfere with some of our programming, and we don't want to complicate the recording that we're doing and the information that we're going to share. The panel is being recorded and will be posted on the Office for Culture and Community Engagement website next week once we've done our editing, but the breakout sessions will not be recorded. For today's program, we will be hearing from leaders from Harvard-affiliated hospitals. Following their welcome, we're going to have two panels, one led by program directors from across the Harvard medical community, and then one led by current residents. From here, you will have an opportunity to join the breakout session for your area of interest that you mentioned during the application process, where residents and program directors will be available to answer the questions that you may have. So with that, let's begin with some welcome remarks from our Harvard-affiliated hospitals. First, I want to introduce Dr. Danielle Ovechki, who is the faculty director for the Office of Culture, Belonging, and Engagement at Beth Israel Deaconess Medical Center. She is an assistant professor of medicine here at Harvard Medical School. Then you'll hear from Dr. Mary Lou Jean-Baptiste, who is the director of Minority Affairs, medical director of the Healthcare for the Homeless at Cambridge Health Alliance, and assistant professor of medicine at Harvard Medical School. We'll also hear from Dr. Marcella Luercio, who is an associate program director for the Boston Combined Residency Program in Pediatrics, also a pediatric hospitalist at Boston Children's Hospital and an instructor of medicine, pediatrics here at Harvard Medical School. We'll also hear from Dr. Ryan Hassan, who is the director of the Office of Engagement and Enrichment an associate surgeon in the Division of Thoracic Surgery at Mass General Brigham Hospitals, and an assistant professor at Harvard Medical School. And then last, you'll hear from Dr. Caitlin Conley, who is the residency program director for radiology at Mount Auburn Hospital. So with that, I will turn it over to you, Dr. Ovechki, for your first introduction.
Thank you so much, Alden. Thank you so much, Joan, for putting this together. It really is a highlight of the fall. And I am delighted to welcome everyone to the Harvard Medical School Showcase. It's an honor to welcome you to this session about training in Boston, living in Boston, and being part of the Harvard Medical School system. Whether you're across the country, across the globe, or right down the street, I'm so glad you're here. Boston is now my home, but it wasn't always. I come from a tiny two islands called Trinidad and Tobago, and I came here with very little. I was the first doctor in my family. I had no wealth, no connections, but I did have the strength of my roots and the power of community. I currently serve as the Faculty Director of Culture, Belonging, and Engagement. I'm a geriatrician, a hospitalist, and a nocturnist who, by choice, primarily works at night. I love, 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 love seeing patients, as anyone who knows me knows. And it's in those hours I meet people from all walks of life, often at their most vulnerable. And I'm deeply grateful for that privilege. A little minute about me, so hopefully you can see some of yourselves in my story. I attended Dillard University, which was a historically Black college and university in New Orleans, where I was shaped not only intellectually, but spiritually. As Bell Hooks once said of her own family, I was immaterially privileged, but I carried the richness of my Caribbean upbringing, or I should say, and the spine of my HBCU education. It gave me perseverance, vision, and a belief in an unseen, better future, not just for myself, but for those on the margins. And it's that belief, that hope that brought me to Boston, and it is what joyfully keeps me here. And this is what I want you to leave here knowing. Massachusetts and Boston have long declared their values, a public commitment to immigrants, the poor, the marginalized, and to science and its power to heal and transform. Living and training in a place that strives, despite its flaws, to live those ideals makes me proud to serve this city and this state. Now, at Beth Israel Deaconess Medical Center, where this institution that I love so much, and I have the honor of representing, our story goes back more than 100 years ago. We were founded to care for people who could not get care nor practice elsewhere. And you know what? That mission has never changed. 50 years ago, long before the murder of George Floyd, we created one of the nation's first hospital partnerships with a federally qualified community health center, Dimmock Health Center. Their patients came to us for life-saving care, and our doctors went into those previously red-lined neighborhoods. That partnership continues today. Because of that legacy, 40% of our patients are people of color, even though we are a quaternary referral hospital, which we extend all the way to New Hampshire, which is a predominantly white state. We don't have private floors. Every single patient, regardless of income, status, receives top tier care and gets to get their care in our brand new, most beautiful, incredibly inspiring building. We innovate without bureaucracy. And with our merger with Dana-Farber Cancer Institute, we're going to grow to more than 1,000 beds, rooted in innovation, excellence, and a roaring heart of equity, creating miracles for our patients every day. We're also unique in our Harvard system. Our physician group is independent of the hospital. That means our voices and your voices matter. We advocate for our patients and our trainees. On a personal note, BIDMC has given me a life that I love. I'm a proud mother of three with a crazy busy husband and a beloved extended family back home who I financially support with joy and gratitude. My career here has never asked me to trade purpose for presence. It has allowed me to thrive as a physician, an educator, and a whole human being. And that's my wish for you, for everyone on this call. Our mission is not just to train you, but to help you flourish, to become your version, not anyone else's, your version of a successful physician, rooted in purpose, connected to community, and prepared to lead. So, whether or not you choose Boston, thank you for imagining what your future could be. We need you. Our patients need you. And I would be honored to welcome you to this city, this calling, the calling of being a physician, and this community. Now, no matter where your path takes you, I want you to remember two important things. Being a physician is the privilege of a lifetime, a key that opens the door to a lifetime of fulfillment. And second, no matter what anyone tells you, the sky is the limit. Go get them.
Thank you, Danielle, for that presentation. I see some hands coming up. You've really got us kicked off in an exciting mood. Next, I'm going to turn to Dr. Jean-Baptiste from Cambridge Health Alliance.
Hello, everyone. This is a pleasure for me to be here. My name is Marie-Louise Jean-Baptiste, and everybody calls me Malu because it's a composite name, and here we don't have time for that. I am from Haiti. I grew up there and came in only for a few, just to get to training, but my goal was to go back to Haiti. And here I am, still working. I trained at Cambridge Health Alliance, where I stayed. And when I joined CHA, this was the era where people were talking about HIV. And Haitian, unfortunately, we are targeted as a nation rather than group behavior. That created a lot of stigma. And in that's how I started my training. As a Haitian, I thought I may have HIV myself. So every time they were talking about HIV, I was looking to see if I had this sign. Then after my training, the hospital opened the HIV clinic at Zinberg. And of course, I was going to do primary care, and they asked me to be part of the team. And to me, that was the greatest opportunity to work there. And it's really opened the view for me of medicine in general, to understand patients where they are, because a lot of patients with HIV are stigmatized, and they especially the Haitian patient, they didn't want their family to know because they were losing their job and everything else. So very early in my career, I see myself as a pawn between the medical world and the Haitian community. And that's why I love so much community medicine. So very early, I heard about outreach, how it is important to understand where the patient is coming from, and to also learn how to reach out to them. So that's how very early in my career, when I was a consultant for the HIV outreach team. So I used to do a radio show, and I still do it now, but with a different organization. So I have said enough about me, but I just want to let you know about CHA, Cambridge Health Alliance, where I've been practicing for 36 years. So some of you were not born yet. So, and I work in different places. I do HIV primary care, and I also do the bulk of my practice is primary care. And CHA, it's a regional healthcare system. They have two hospitals. One of them is at Cambridge, and the other one is at Everett. And they have 20 sites, primary care and specialty medicine. And there are multiple training programs, but I'm only going to mention three of them. So we have the primary care, actually four of them, the primary care program, and the transitional program, the psychiatric program, and the family medicine program. So at CHA, she is well recognized for the care of the community. and we really think about vulnerable population, and the residents are trained to do advocacy research. And we also, beside the didactic and being in an outpatient clinic and also inpatient, but they also have the opportunity to work in the community. And some of them, if they want to come and work with me, because I do group visit and also I do um, cooking class, because that was one of the ask of my patients. So I went and I got a certificate. So we have a freestanding cooking, a freestanding kitchen at Windsor. So the student, Harvard student, and also Tufts student are able to come and then get some experience. And about the radio, we also do community outreach, because some of the patients, some of our patients, they are not well versed in the internet. They're not digitally literate. So they get their information in the radio, and the information they get is not necessarily the good one. So in order to uh, of I could not do anything about it but do my own show where people can trust, and then they can come and get some information. So we also working with other population, and some of the work that I have done are being done in other part of the hospital. So I also want to say one word about healthcare for the homeless, where I was a medical director for many years, but I just want to finish there. And now they also have a segment of street outreach, where there is a team of doctor, nurse practitioner going there and meeting the patient where they are. So thank you for the opportunity, and it was great to talk to you all.
Thank you for that introduction, and it's always great to hear from you, Dr. Jean-Baptiste. Next up is going to be Dr. Luercio from Boston Children's Hospital.
Wonderful. Thanks, Alden. Hi, everyone. It's my honor to welcome you all. I wish I could see every student's face on my screen, but I've been scrolling through, and it's nice to see so many of you here today. I want to welcome you on behalf of Boston Children's Hospital and its Office of Health Equity and Inclusion, which is led by my dear mentor, Dr. Valerie Ward, who could not be here today. Similar to others, I was not born here. I was born and raised in Fortaleza in Brazil. And I decided to come to Boston, specifically to the Boston Combined Residency Program in Pediatrics, because Boston has a very large Portuguese-speaking community. And I knew that I wasn't going to most likely move back home, but there was my way of being part of my community. But I really stayed on as a faculty because I've been really just truly impressed by Boston Children's unwavering commitment to serving medically underserved children and advancing their care through research, advocacy, public policy, community engagement, and education. Today, I have the privilege of doing clinical research aimed at improving care for patients and families who speak languages other than English. I partner with institutional leaders to improve our patients' access to interpretation and translation, and I really wake up every day with a deep sense of responsibility, but also hope and fulfillment. So I want to say to our students, when you're learning about the residency programs today, ask yourselves, will this program bring me purpose and joy? My story, as you can hear from others on the panel, is not unique of coming here and staying here as faculty. Many faculty at Boston Children's have also come for residency and stayed. And they stay because it's a really, truly special place. I know we don't have a lot of time, but I want to highlight one way that Boston Children's drives its mission forward, and then that's through the Office of Health Equity and Inclusion. The office provides guidance on achieving a healthcare environment that honors equity, diversity, respect, inclusion, and excellence. One recent initiative of the office was the creation and widespread education and dissemination of a novel bystander to upstander training across the hospital. So most of our staff has received this training, which is wonderful. And this is just one example of the many initiatives by office and across the hospital. And they're often championed by our resident leaders. I want to say for our students, if you come here, we'll work side by side with you. And our goal is to develop leaders in pediatrics and to launch people's careers. And in short, really, Boston Children's and the Boston Combined Residency Program is really, truly a special place. I'd be happy to take questions and let you know more about our program in our hospital. But I want to say thank you for taking the time to be here today. Please ask the tough questions, and we hope to see many of your faces in our residency program as future pediatricians.
Awesome. Thank you so much, Marcella. Next is Dr. Hassan from MGB.
Hello, everybody. My name is Ryan Hassan, and I'm a thoracic surgeon here at Brigham and Women's Hospital. And to be sitting on this panel means a lot to me because I did my general surgery residency here not too many moons ago, but enough to have gone and come back to the nest. So this is actually my third time living in Boston. I am originally from Southern California, born and raised. I went to Berkeley for undergrad, went to the Keck School of Medicine at USC for medical school. And it's actually funny, there was a little transition. My first time living in Boston was in a post-bac program. So I was at Berkeley, majored in psych, was pre-med, wasn't really sure, like, am I sure I want to do this? I wanted to be a doctor since I'm 7, but there's so many other things in this world that I could possibly be doing. So I talked to one of my advisors and he said, well, why don't you do a post-bac program? Graduating psych, do a post-bac program, you'll be great. You haven't even taken any of the prereqs, so you could graduate on time. And I thought, great, I'll do this. So I actually came to Harvard Extension for my post-bac program. And it was my first look at just being in Boston, being close to the undergraduate campus and just seeing what it had to offer. And I was excited. I have a twin sister that was actually across the state at UMass Amherst. And so being able to see her and being close to here, I knew that.
Dr. Hassan, you're muted.
Yeah. Can you hear me now? Okay, perfect. Sorry about that. So I ended up I came out here to Boston, did my post-bac, but unfortunately life circumstances and illness in my family drew me back to California for medical school. Had a wonderful time though, and it was really my first exposure in the clinical world to health equity and differences. We were at LA County Hospital, and so you just saw so many people that did not have access to care, everyone presenting with stage 3, stage 4 disease, and just really needing that help. And then in the same university campus, there's University Hospital where it's referral only. There's no emergency room. You have to know somebody to get in there. It's, top tier care. Even the scrub attire that you wear in the OR is different at that hospital than at LA County. And just seeing how two places could be so close to each other, but have different access streams and different patient presentations wanted me to close those gaps. And how come patients at this other hospital can't have the same resources that the patients at the university hospital have? So this all set the stage. It was at that time that I actually had my first exposure to thoracic surgery. And, at the time there were only 5 Black women that were board certified in cardiothoracic surgery in the country. And I knew none of them. And I didn't know any of the men either. And so luckily I found some mentors in surgery that took me under their wing, specifically in thoracic surgery, and helped me to believe that I could do this. And so I ended up matching to Brigham. We have an amazing thoracic program here. You'll hear from our program director, Dr. Mike Jacklich, in a bit. So just to put that plug out there. But I really just learned how to become the woman that I am today, the surgeon that I am today, the healthcare leader that I am today, and really just help to cultivate my research interests. So I do lung cancer screening research and helping to bring mobile technology, a CT scanner on a truck, to neighborhoods that need it. Specifically, we're working in Dorchester, Mattapan, and Roxbury here, which are Brigham priority neighborhoods. But it helped me to develop that skill set to do that. And now I had actually gone away after residency. Most people stay here, but I actually left the nest, which I'm thankful for because I had a ton of a different exposure. I went to the Ohio State for my cardiothoracic fellowship and then Mayo Clinic for my thoracic training and just learned a ton. And then I was faculty at Dartmouth Hitchcock, which is just up the way in New Hampshire, for 5.5 years. But I was recruited back here to become the inaugural vice chair for faculty engagement for the Department of Surgery, and then just took on this job literally 2 weeks ago. So very excited to be here and just, really just show you what we have to offer. I think, so I work in the office of CADE, which stands for the Center for Academic Development and Enrichment. And really what this is a center that's designed to make us be the best people that we can be so that we can take the best care of our patients. And I think that that first starts with the faculty because we're the ones that are going to be teaching you, taking you under our wing, showing you what needs to be done, teaching you how to operate if you go into surgery, teach you how to take great care of patients, teach you how to do procedures if you want to do something procedural. Whatever you want to do, I think one of the things that I've seen throughout my experiences here is the world is your oyster. You cannot dream too big. There's somebody here that can open up the doors and just lead you right to the person that, hey, and if it's not that person, they know 3 other people that might be able to help you. I will say this, my program director told me on day 1, nobody's going to hand you anything on a platter though. So let's, you do have to go out there, but it is so worth it to take that leap of faith, talk to people, understand what they're doing, understand what you want to do, understand what difference that you can make in this world, to really just help people around you. I think, I think it was Dr. Danielle said, medicine is such a privilege. And the fact that we are able to make such close connections with people, really at the most vulnerable time in their lives. I'm a cancer surgeon, so they see me when they've gotten the worst possible news that they could have ever have gotten. And to be able to make that connection with that patient, and just help get them through this. It's the skills for that I learned here. And you can continue to learn that here too, when you're going throughout your medical journey. So I'll just say like 2 quick things about CADE. I started with the faculty. There is also a whole section that's devoted to trainees. We have a resident house staff council that you can serve on. There's many affinity groups through that. And really it helps to bring to us what you need as residents to not only just survive this, because that's not the goal. The goal is to thrive, okay? And really just get out there, be your best selves, and be who you were meant to be in this world, without letting others dim your shine or, fall prey to the distractions and obstacles around you. Because I will say right today, there are many, and it's easy to fall off course. But here, I know throughout my experiences, and I think a lot of people on this panel would say, I truly found my family. And these people that I know here are my extended family and just have helped me along this journey. So I will leave time for everything else. I don't want to take too much, but I am happy to answer any questions. But I just thank you so much for coming. Thank you for hearing about all that we have to offer. Even just sitting here, I just still feel so privileged just to work with these amazing people. And I hope you feel the same way. And this could be you too. So take that advantage, but hopefully we'll answer your questions and you get a good look at what we are here. Thank you.
Thank you, Ryan, for your comments. And not to take away from the wonderful words that we've heard from all of our speakers, I just want to point out that so far, everyone has introduced themselves as from these beautiful warm weather climates, and they have learned to survive living in New England. So for all of you Northerners who are concerned about the weather, you have someone from Haiti, Trinidad and Tobago, Brazil, and even sunny Southern California, and they are all living, working, and thriving in Boston. So it is possible to do so. Next is, and certainly not last but not least, is Dr. Conley, who's going to give us a welcome from Mount Auburn Hospital. Dr. Conley.
Hi, everybody. I wanted to add my welcome and thank you for joining us. I guess I'm the outlier. I'm actually from Boston, but I think, we have all 4 seasons and it's beautiful here. And it's wonderful because you get to meet people from all over the world. I think it's, Boston's a majority minority city. It's very diverse and it really draws people from all over the world. So it's a great place to be. So I'm thrilled to be here representing Mount Auburn Hospital. I'm the program director for the radiology residency at Mount Auburn. And Mount Auburn Hospital is a community teaching hospital. We're located in vibrant and diverse West Cambridge, right down the street from Harvard Square. And the hospital mission of Mount Auburn is a 2-part mission. It's to improve the health of residents of Cambridge and surrounding communities through the delivery of excellent and compassionate care. But also, Mount Auburn is equally committed to teaching students of medicine and the health professions to benefit the next generation of patients and their families. So really, teaching is at our core mission. And as part of that, we have 2 ACGME accredited residencies. We're definitely a smaller hospital, but it has that, community feel, and you really get to know everybody, and you're sort of a person and an individual that's known by the whole group here. But we have an internal medicine residency and a radiology residency that are ACGME accredited. We also have a podiatry residency and have residents rotating with us from the Beth Israel, so surgical residents and emergency medicine residents rotate at Mount Auburn. And also we have a joint urogynecology fellowship with the Beth Israel. So we're part of the Beth Israel Leahy network. So we have work in close collaboration with folks at Beth Israel. And we really want our residencies to reflect the diversity of our patient population because we know that patients who see themselves reflected in their doctors have better health outcomes. And to accomplish that, we really focus on sort of holistic recruitment to both recruit and retain residents and faculty, and really evaluate our applicants on their skills, their goals, their experiences to really recruit that diverse population. And that really leads to our team being, from all over the world. We have residents and faculty from all over the world. To highlight our internal medicine program, it's 50 residents strong, including 8 preliminary residents and then 14 categorical residents per year. And a highlight of the program is the graduate-led ambulatory health disparities curriculum that's focusing on treatment of underserved populations. And you'll hear more from our program director for internal medicine on the program director panel, Joe Amlor. And our radiology residency is 12 residents strong with 3 residents per class. So we're a pretty tight-knit group. And we are proud to be a pilot site for the Association of Program Directors in Radiology Healthcare Disparities curriculum. We also have residents who are very involved in health equity and community outreach, including one of our residents serving as the health equity officer for the Massachusetts Radiologic Society resident and fellow section the past year. And we also have a strong history of global health involvement. So I look forward to being able to talk with all of you in more depth, or some of you, I guess, during the breakout sessions. But again, welcome, and we're so glad you could be here to join us.
Awesome. And again, I just want to say thank you to you wonderful people. You all are amazing physician leaders within the hospitals that you represent. And you also took time out on your Saturday to be here to do these welcomes and to speak to our trainees, future trainees. And I think it's a testament to your commitment to the Harvard affiliated residency programs that you represent and the hospitals that you represent. And just thank you again for being here and sharing the welcomes on behalf of your hospitals. With that, I do want to now pivot as it's time to get into some of the panels that we have planned. And our first panel is going to be a panel led by Dr. Dennis Spencer. We're going to have a residency director panel. So Dr. Dennis Spencer is not only a pediatric gastroenterologist, but also a very good friend of mine that I've known for more years than he and I would both like to admit. He's at Boston Children's Hospital, where he continues to serve as the director of the equity, diversity, and inclusion efforts for the Division of Gastroenterology, Hepatology, and Nutrition. He is an associate program director for the Boston Combined Residency Program at Boston Children's Hospital and at Boston Medical Center. And within the Office for the Graduate of Medical Education, Dr. Spencer holds the dedicated role as the BCH medical educator, managing the hospital's education outreach efforts for resident and fellow training programs. So with that, I will turn it over to you, Dr. Spencer, so you can introduce the panelists and can lead this session with our program directors.
Okay, well, thank you so much, Dr. Landry, my good friend. And yeah, we just won't tell how many years it's been that we've known each other. But I'm so happy that we have so many participants in the audience here to hear about our amazing training programs in the Harvard affiliated hospitals. We have an impressive panel here of program leadership to talk about our programs. So the format for this particular panel, we're going to quickly go through some introductions for the people before us today who will talk about their programs. And then we'll go into some questions that have been common questions that participants in your shoes have asked in the past. So unfortunately, I'll say this from the beginning, this will not be an opportunity for direct Q&A with those of you in the audience. That will be more for the breakout sessions later. But hopefully these questions will be those that bring some insights, learn a little bit how we think about this as program leaders, and hopefully be something that you think about as you enter into your interviewing season. So I'll start off from our colleagues at Mass General Hospital, Mass General Brigham Hospital, with Dr. Nahed, the Program Director for Neurosurgery. If you are here, please unmute yourself.
Thanks, Dennis, and thanks for the invitation. Thanks for being part of this panel. I'm originally from Los Angeles, so I'll just echo the warm weather to not as warm weather, and absolutely just love Boston and obviously this ecosystem. I'm Brian Aid. I'm our program director of the Mass General neurosurgery program, which now is one department, so it's actually Mass General Brigham, although our residencies are in the process of applying to become one, both at the MGH and the Brigham. I can speak a little bit to the experience both at MGH, but also just the training as in neurosurgery in general within the system, because we do rotate through the hospitals, including children's. We've been pretty fortunate. Part of the reason I'm in, or actually the large reason I even came to Boston was this is just an amazing ecosystem, and you'll see so many different program directors representing that. And it really is reflected in the hospital, not only the people that we work with, but more importantly, just the number of cases that come through. And that's very true in neurosurgery. We've been really fortunate to have an amazing training program, at least for ours. We have three residents a year, 7 years total, so 21 residents, and that's both at the Mass General as well as 3 at the Brigham. So our hope is that in future years we'll be the largest program in the world, which will be 6 resident applicants every year that'll be accepted in. Program is largely based around just getting exposed to a lot of clinical cases. So during the 7 years, we actually give 2 years where you have dedicated advanced work. What used to be traditionally working in a research lab in your 4th and 5th years nowadays is getting an additional degree, doing a fellowship, doing global health work, or even doing a startup. If you look at most of our graduates, a lot of them have really been instrumental in changing our field by some of the amazing work they've done as a resident. And we really want to champion each and every one of our residents who do that. If I were to summarize the advantage of our program over any other program, we really look for neurosurgical leaders, people who are going to change the field in a way that I can't even dream of. And yet somehow we have to find a way to not only support those folks, they're all unique and they come from varied backgrounds, from different interests, and we don't have a very cookie cutter approach to it. Our goal is to train the best surgeons, but then to also arm them with the resources to really do something really creative. As a program director, I've been doing this for 10 years. I truly love doing it. We have about 300 applicants for 3 slots. And that's pretty typical for neurosurgery. And so we interview about 30. So it's a pretty large jump to get into that interview. But once you get in there, I always say that it's sort of a clean slate, and it's really how you do on your interview. The things which you'll probably hear from the other program directors that we look for in general are people who have excelled not only in the specialty that they're interested in our case, neurosurgery, but frankly, every aspect in their training. And that even starts early on. And traditionally, we do like to see people doing something really creative with, again, the resources that they have and the environment they have. So if you're at a school that has access to really amazing research and you're doing something, we want to see that you've done it well. I'm sure it'll come up a little bit later, but I'd say about half our population goes straight through that applies, and about half take an extra year for some type of activity. It's not always research. Sometimes it's an additional degree or some other interest or work in a startup. With that, I'll hit pause and I'll turn it over back to Dennis, and I look forward to the rest of this panel.
Okay, thank you so much. And as we move forward, just for the sake of recognizing our welcome panel took a little bit longer, we will try to use some of this time here to talk about specifically everyone's roles here. And because I don't want us to get too much into our specific programs, because I want this to be a little bit more broad for the, 300 participants here today, which is so amazing. With that, I'll move over to Dr. Neves, and you please help me correct your name.
No, it's fine. Sarah Nevis, but I answer to anesthesia all the time, so that's fine. I am the program director for the anesthesia residency program at Beth Israel Deaconess Medical Center. I did medical school at Sidney Kimmel Medical College in Philadelphia, where I grew up, anesthesia training at Yale, critical care fellowship across the street at Brigham, then joined BIDMC in 2015, and then I became the PD in 2020. So we have a program that takes 16 categorical residents and 6 advanced, so for a CA1 class of 22.
Okay, thank you so much. And I am so guilty of calling anesthesia in the OR, so my apologies. Alrighty, and if we can go to Dr. Hastings, know that she is taking over today from her program director from CHA. So Dr. Hastings, please introduce yourself.
Thanks so much. My name is Dr. Stephanie Hastings. I'm an APD at the Cambridge Health Alliance Internal Medicine Primary Care Residency, filling in for Dr. Rogers, who's coaching soccer this morning. I really happy to be here to represent CHA. You already heard from Dr. Malu Jean-Baptiste a little bit about our hospital, actually. We're a primary care internal medicine residency program. We actually recruit eight applicants, and so in the breakout groups I'll be happy to speak more about kind of if you're interested in our specific program, but I look forward to hopefully helping all of you who are about to set out on this very exciting time in your careers.
Thank you so much for being here, Dr. Hastings. Dr. Young, if you can talk about OB/GYN at MGB.
Hi, good afternoon. Thank you for everyone taking time out of your busy schedules to chat with us this weekend. I'm Ari Young. I'm a general OB/GYN, and I'm in my second year as a program director for the Mass General Brigham OB/GYN residency. I'm also a graduate of the residency program, and also I did medical school at Howard University College of Medicine. And our residency program covers our 2 academic medical centers and also some of our satellite institutions. And we take 11 residents per year for a total of 44 residents. And looking forward to chatting with more applicants and students who are interested in OB/GYN later.
Thank you so much, Dr. Young. Dr. Lamas, and once again, please correct me if I mispronounced your name.
That was perfect. It's so nice to see everyone. Thanks for joining us today. I am a primary care physician and endocrinologist and the internal medicine program director over at the Brigham. I've been in this role now for 2.5 years. I was an APD for many years beforehand. And like Dr. Young, I actually did my residency training at the Brigham and went to med school at Hopkins. Looking forward to talking to you and answering questions.
Okay, and Dr. Fitzgerald, my pediatric program director colleague, please.
Thanks so much, Dennis. Hi, everyone. I'm Dr. Sean Fitzgerald. I'm a pediatrician, as Dr. Spencer mentioned, and I am the program director here at Mass General for Children. I have been in this role as the program director for about 4 years, and I am likewise, as many other folks have mentioned, a graduate of my own program. I did graduate from my program and actually headed out to the West Coast for a while to complete a fellowship in pediatric hospital medicine in the Bay Area, and worked for several years as an associate program director at Kaiser. But like many of us who have trained at Mass General, we kind of feel this gravitational pull back here at some points in our career, and that is exactly what I did. And I came back here to take the reins of my program back in 2021, and it has been really a wonderful experience in every way, shape, and form. And I'm really honored to be here and to share a little bit more about our program later on. But I'll pass it back to you, Dr. Spencer.
Alrighty, thank you so much. And Dr. Omler, you'll round out our panel. Please introduce yourself.
Yeah, thank you. I'm Joe Omler. I'm the program director for the internal medicine residency at Mount Auburn Community Hospital in West Cambridge that Dr. Connolly introduced earlier. I am originally from Michigan, so the weather is just about the same. But I moved out here in 2014 to join the program. I served as a chief and then worked as a hospitalist and APD for about 5 years before taking over as the PD 3 years ago. So we are a 50 trainee program in total. We take 14 categoricals every year, 8 prelims along with that. And we intentionally match a diverse group of folks from all over the world that bring along diverse interests and goals. It's great to see so many of you on the call. Thanks again for having me here, and hopefully we can be helpful.
Excellent. Thank you all for introducing yourselves. And I'll take some moderator privilege here too, because I did not mention where I'm from. And it's hard for me to be on a panel and not mention that I'm a Morehouse man. So I'm originally from Baltimore, went to Morehouse College, trained my MD and PhD at Cornell University before going to Stanford for residency. And then I came also to Boston Children's for my fellowship in gastroenterology before then staying on as faculty. So been in many warm places, but I've settled here now for quite a while. Okay, so as I mentioned, we've had some number of questions in the past few years. We've done this that are pretty recurrent, that we think are going to be still relevant for many of you now applying. So a question that'll be open to the entire panel, if you can talk a little bit about how your program has approached holistic review of applications. Okay, I will have this. I'll start this off with Dr. Fitzgerald. If you want to give us a couple ideas of how you've looked into this.
Absolutely. So, I think holistic review is something that our program has done for many, many years, and it's predicated on this, understanding that like there's so much work that goes into your application, and more importantly, it reflects years of work, and it owes our attention to every aspect of that. So for our program, as I know is similar to many programs, we don't observe any cutoffs in terms of like step scores or ranking your schools in any way, shape, or form. We look at your academic record, your clinical performance, focusing a lot on your performance in your clerkships. And of course, I'm a pediatric residency program director, so we're really looking at your performance in your pediatric core rotation and your pediatric sub-Is, or maybe some of your electives. And then the other rotations are just as important, especially in internal medicine, so we do take a look at that as well. And then your letters of recommendation, that's where we get some insight into people that really like work with you directly. Beyond that, we also look to the things that are important to you, that are laid out in your ERS application, those meaningful experiences, and what you write about in your personal statement is particularly important to us. It's really where we get to understand you as an applicant, and all the things that you'll be bringing to our program, and more importantly, to the care of our patients. We have here in Boston, and I know across all of these institutions, we really have the privilege of taking care of a wonderfully diverse patient population. And to be able to do that well, our trainees need to reflect that diversity too. And so we want to take into account all of those experiences that people have, in those areas of advocacy and passion that they bring as well. And I kind of referenced this a little bit, but we also look at distance traveled in your life. All of you bring a wealth of experiences through your life, and both in medical school and before. And we know that those are experiences that are really going to inform who you are as a physician, and is really going to help you truly understand the patients that you'll be taking care of. So that has been our approach to holistic review. Understandably, it takes a little time. So after we receive your applications, it's going to take us a few weeks to get through all of those. But it is one that myself and all my colleagues that assist me in this process here at Mass General really enjoy each year to see all the amazing accomplishments and life experiences of all the folks that apply to our program.
Excellent. Thank you very much. Actually, I'll have anyone else who would like to volunteer, maybe their approach that could be a little different, acknowledging that depending on your program, many of us receive so many applications that there may be some need to have cutoffs or other ways to kind of shorten the process somewhat. Depending on how many people we have at our disposal to do this review, there's practical implications there if you have our smaller programs. So recognizing that there are many reasons why it could look different from program to program. If anyone else wants to share their experience or their approach, that'd be great. Dr. Nevis?
Yeah, sure. While I have a lot of commonalities with Dr. Fitzgerald, I will say the program signaling in anesthesia has really helped us prioritize the applications to enable more holistic review, right? Helps narrow down our applicant pool of applications that we review. So it's not really cut off so much as very clear identifier of if we are in your top 15 of programs, right? And so then we can put a lot more of our attention. The other piece that I wanted to add is, we're always looking for a diversity of thought, interests, skills, strength. And so to that end, our recruitment committee is made up of not just myself and the APDs, but a diverse collection of our faculty, right? In the various subspecialties, some generalist faculty that are experienced and have been at BIDMC for a while, along with some of our junior faculty, people who trained in our program, people who didn't, to also kind of bring some more nuance. I know personally that I will look for my own favorite type of resident, right? I have my own kind of bias when I'm looking through applications, and I recognize that I won't be a perfect predictor, right? Looking through. So what I rely on the colleagues that I trust, and they always bring really interesting insights and perspectives that add to the, I think adds, is holistic review kind of in a different way, right? Not just the application, but the people who are doing the reviewing.
Is there anyone else? Yes, Dr. Yellum.
I'll just, because you said larger programs, we get, I think, 3,500 to 4,000 applications a year. And I'll say we also do not have any cutoffs, just like that were mentioned by the others. What we do is we've just expanded our committee. We've trained a lot of people, a lot of faculty, in addition to the APDs, to be really good with holistic review, double screening, and so forth. And with that, we have a larger committee, but we're able to spend more time with each application. And I think here at the Harvard institutions, I think all the internal medicine residencies, although they get a lot of applications, have done the same.
Excellent. And also, just to make that mention, because there is that practical part around just the size of programs. For Boston Children's, the Boston Combined Residency Program, rather, we receive roughly about 1,900 applications a year. We receive about 50% of all domestic MD applicants and almost 80% of all IMGs who are applying every year into pediatrics. So for that reason, we have 14 screeners, and this typically ends up being about 1,200 to 15 hours total when you do it cumulatively, the amount of effort that goes into this. So this is certainly a huge undertaking on our part. Also to mention, we do this without necessarily adding additional FTE for it. So these are people who are just dedicated to bringing in the most excellent candidates, looking at all those factors that everybody else has already mentioned. Okay, well, someone also mentioned signaling. So I will bring us to that question about how do your programs think about both program-specific and geographic signaling, and how does that integrate it into your holistic review? Dr. Young.
Yeah, so for obstetrics and gynecology, I believe we're in our 4th year now of utilizing signaling to help with the recruitment process. And the way it's been communicated from our professional societies is that it's an opportunity to create equity in the communication between applicants and programs. As you know, being in a large academic center, we are probably already starting to get emails from colleagues from other institutions. Oh, I have this amazing applicant, I have an amazing student. And again, that's great to hear that. But to create access and opportunity and to be able to formally communicate your interest in our program, I feel I'm a big advocate in the signaling that we use. And I communicate that to all applicants, no matter if you don't feel like you're fit our prototypical matched applicant, that if you are interested in our residency program, you should signal us. For OBGYN, we have 18 signals 3 are gold and 15 are silver. So the gold are the highest interest. But again, I think I'm a big proponent of that. And we emphasize to applicants that apply to our program that we really hone in on the signaling before we expand to the rest of the applicant pool.
Interesting. I saw that Dr. Amler's hand was up as well. Did you have something to add?
Yeah, I think I'd go along with all of this. It's a lot of the same question. I think as an internal medicine program, we get 7,000 applications every year for 14 categorical spots. And it makes it incredibly difficult. And I think I go along with Dr. Young there and say that over the past couple of years, our societies as well as our program have felt that it's really important to give those people a shot, the people that do come out and signal with a gold signal or a signal. It allows us the chance to have those applications really rise up and make sure that they're thoroughly reviewed, even if they're not from the area or it's not a colleague that I'd had in the past that can vouch for them. It gives everybody a shot. But I think it is a very important part. I wouldn't say that we only look at applications that are signaled, either with the gold, silver, or geographic. I think that would be silly, and I think there are a lot of reasons you may or may not choose to signal a program, but I do think it's a very important part.
Okay.
I just wanted to add one thought about just for in general, especially for anesthesia. If you feel like you have vulnerabilities in your application, mid-tier programs signals will be valued more, right? Then top-tier programs get a higher percentage of the signal. So it's worth really doing some reflection on your application and using signals strategically, because they will have more weight for programs that may not get a lot of signals.
That's an excellent point. Thank you. And Dr. Nahad, I'm just curious because neurosurgery, of course, is a particularly competitive specialty. How are signals looked at your program, and if you know, also in general?
Yeah, it's a great question. Neurosurgery is late to adopting the signals, and we're probably, I think, either 3 years in or 4 years into this. And I would say that a lot of programs do look at signals just because it's new. It's sort of varied as to how much people rely on it. We don't have cutoffs, and we don't only look at signals. We actually do that at the last part. So we basically, just like everybody else mentioned, have committees that are pretty diverse and read through absolutely every application. We've been doing that even before the step scores sort of moved. And then after we pick the folks that we're interested in, we meet as a group and then usually call that down. That's at the point when we start to look for signals. So in general, in neurosurgery, what I usually give advice to, particularly for any of the smaller specialties, what they've done over the last several years is really reduce the number of signals so that with the hope that applicants aren't applying to 50 programs, and therefore you really will call down to the programs you really want to or think you have a shot at. It's meant to help the applicants, but I think sometimes programs will use it as understanding who's really interested. So I often advise people be really sort of strategic about who you're applying or who you're signaling, because it's quite important at times. One of the things we do in a small specialty is sub-Is and both home and away, which I suspect Dennis is going to probably come up, but that is a very, very crucial part of the application and way more important, at least for us, than the signaling.
Perfect. No, that is certainly similar to our approach as well, but it's interesting to hear because especially for programs who have fewer signaling positions. For pediatrics, we have a limited number of slots where you can signal compared to many other specialties. So there is that component, but for our program, we certainly use this really at the margins at the end. If there are two very similar individuals who are applying, and our top people, if we want you, we're going to not even look at your signal, we don't care. But if we are more at the margins, we are going to probably preference the person who has signaled us if it's really coming down to that kind of head-to-head. So being strategic, recognizing the strength of your application, and also leveraging things like those aways and other visiting clerkships are so critical. Now, another popular question, because looking at our time, many people are brushing up their personal statements right now and trying to think about how best to position themselves and talk about their narrative to impress us. So I'm curious, do you have any words of advice in putting together the best personal statement possible? Who would like to tackle that one?
I'm willing to take a stab at answering that question. That sounds good. So I think the advice I'm going to give is not terribly groundbreaking, but your personal statement should be a personal one. It should really speak to what is not otherwise in the rest of your application. Occasionally I do see personal statements that are kind of a narrative retelling of your CV or the things that are also, otherwise in your application. It's really an opportunity for us to get to know you, right? And the ones that really stand out are those ones that have that like really good hook in the very beginning of that personal statement. We're reading thousands of personal statements, so those ones that really stand out are the ones that have a really important statement that they start off with at the very beginning. Those are the ones that like stand out in our mind, or the ones that really tell this incredibly like compelling story, tells us of like a little bit of your arc towards in my case careers in pediatrics and what led you there. Those are the ones that are really like stand out. So I would take that opportunity as a personal statement, as an opportunity to really get your application to stand out. And I think it can do that by really telling that personal story of your personal path to a career in pediatrics.
If I can direct everyone to the chat, because Dr. Nevis just mentioned resist chat GPT, please, please, please. just don't. But also, Dr. Fitzgerald, I think, says a great point that I just want to double down on. We've read your CV. If your personal statement is really just a narrative of your CV, I mean, that's a wasted opportunity. Is it going to be the reason we don't interview you? No, but it's certainly not going to give you bonus points, and it's not going to excite me about you as an applicant. So this is my own personal view, but who else has any thoughts about what they'd like to see? Dr. Yalamas.
So exactly what you just said and Sean said about don't recapitulate what's in your CV, because as you heard, we're reviewing so many applications. The other thing I would say, as we talked about holistic review, the personal statement is part of that. So really talking about your experiences, but also making sure you're succinct. Sometimes people can be very long-winded in their personal statements. So make sure it's succinct, make sure you've had someone else put eyes on it. Some of your mentors, even 2 mentors, give you some feedback to make sure you're getting across exactly what you want, especially around your strengths and your journey and why you want to do what you want to do, what you want to do in the future. So we can really capture who you are.
Anyone else? And I think this is really important that you guys have said all the things I love to say as well. So I think we may be all in agreement, but anything else anyone wants to say to help anyone here? Okay, well, hopefully everyone took note of that. Please don't restate your CV. Also, this is not the end all be all. So for those who are losing sleep over this, also don't do that as well. Just make sure it is clear. Please grammar check, have somebody else read it, and get your application in. The worst thing is just to delay your application. Okay, so another question that is on many people's minds, as we have been now in the kind of virtual world for a while since we've had the pandemic, and we no longer have opportunity for you to have like the night out with our residents or touring hospitals, and this is something that many of us feel has been a shortcoming. But I'm wondering, what are you doing as individual programs to help get applicants familiar with your program? What are you doing to leverage this virtual space? Or also acknowledge if you've gone back to in-person. I recognize that some surgical specialties have. So let us know if you've been one of those specialties that have done that as well. It's Dr. Hastings.
Yeah, I think this is a really great question, and it's interesting how this has evolved since 2020. So I would say we try to we like actually having the virtual option because it is a lot more accessible to everyone. We do offer a virtual dinner the night before with our residents, and we realize that it's really difficult to capture that feeling and togetherness on Zoom, but we do our best. So there is that informal time for applicants to meet our residents. We pay for them to have takeout, and sometimes they'll get together and do it at one place, and we try to get some informal interaction that way so that they can really ask the residents some of those hard questions. I think we also are not judging your backgrounds when you're on, when you're virtual. We understand that people have tech issues that arise, and so it's really we want you to hopefully not feel too nervous on Zoom when you're interviewing with us. I will say we're a smaller program and we're a unique place, and so we actually have brought back a second look option. And so I think other smaller programs are doing that. We don't require it. We actually, as the program leadership, don't even know who comes for a second look because we don't want that to influence our ranking decisions. And this year we are doing something new where we're actually going to lock our rank list a little bit early and then have 2 in-person days where applicants will have already made our rank list. Folks can come and see us in person if they want to and have a more of an interactive day on site. So we're actually bringing back some of that in person.
Anyone else wants to?
Oh, sorry. I just wanted to add, we have a morning session, afternoon session for our interviews, and so in between, we just have kind of an open Zoom up in our resident lounge, which is kind of during the lunch hour. So our residents, it's a little bit of an uncurated selection of residents that just happen to be on break to offer like some opportunity for Q&A of kind of whoever's around. I think I'm trying to remember. Oh, and we have recruitment chairs who make themselves available for kind of questions offline. I actually have been one of the few. I like the virtual interviews because I feel like applicants have been more relaxed in their own home personal space. I was someone who got very intimidated sitting in that like waiting room with all the other med students in their suits and like one-upping each other. So I think the absence of that is a strength. Yeah, the getting to know the program is a little bit of a different challenge.
Great. Dr. Young and then Dr. Nahad.
Similar to our other programs, we do a night before meet and greet with the residents only. It's meant to be laid back, relaxed. We tell them to have food, have a drink. And also too, we do a program specific recruiting event too, as another low stakes environment for them to get to know our residents. Interesting too, as far as second looks, our specialty society kind of went back and forth on second looks, but I think what was mentioned earlier, the recommendation from OBGYN was that you have to explicitly communicate to the applicant if you are providing a second look that you've already locked in your rank list and that this is purely for information purposes. It's not a performance or an evaluation process, but our program, we've decided to hold off on second looks for now. But those are avenues for communicating in this virtual world.
Okay, excellent. Yes, go ahead.
We were virtual through the pandemic, and as soon as we could file for an exemption, we did, and thankfully we've been in person for a number of years. I do and love the virtual idea for all the reasons everybody stated, mostly because it allows people to just be in their own home and reflect it. I will say for a long residency like ours, and one of the feedback we were given the years we had virtual was for some people, they had never been able to see the place. And it's really hard to commit to 7 years if you've never seen the place or even experienced Boston. And I truly believe it's such an amazing ecosystem. And honestly, the best part of it is hanging out with the residents and seeing how amazing the hospitals are here. So for that reason, we have been in person as soon as we could, and it's been many years, and we've loved it. Our interview process is we shut down our ORs and we have essentially everybody interviews. Believe it or not, all of our faculty interview and our residents are involved. And it's a 1-day interview, and then you have the evening, which is very low key with the residents and mostly to get to know the program and the culture and really understanding it. Across the nation, at least for our specialty, that's increasingly becoming the standard, and it's rare that people have a virtual option.
And for us, we're completely virtual. We're doing no second looks in person, like Omari with his program. But in addition to the night before having sort of an informal dinner, reception, whatever you want to call it, during the interview day, we actually have you're assigned one of the residents, just random assignment. Whoever's on ambulatory, we sort of assign you, and you interview that resident about the program. They don't interview you; they haven't seen your application. So it's a really good format, so you can learn more about the program. And then the other thing I would encourage you to do is to actually look at the resources the programs actually give you. For example, we give the medical schools where all our current residents are from. And you should contact people from your medical school who have gone to that program, because you know what you like or don't like at your medical school. And how does that residency program compare to that? Has someone thrived from your medical school in that program? I think that helps you a little bit, just for that point of reference. Also, things that are important to you, curricular, also extracurricular. You know, we in our program have a sheet where we have all the where people are from, from the West Coast, East Coast, South, Southwest. And we also have interests, extracurricular interests, in addition to career interests. So maybe someone loves basketball, or someone loves to write, or someone loves theater, and you can actually contact to learn more about what's going on among the residents, to make sure people who have families. What is the environment like? Many residents now have families during residency, so what that's like. So I think it's important because it's hard to capture all of that on your interview day. You're interviewing, you're trying to put your best foot forward, but get that information and afterwards email a few of the residents and try to get more of that information that's important to you. That would be my advice.
Okay. And Sean, it looks like you unmuted. Did you have anything else to add?
Yeah, I think similar to what a lot of other programs are doing, we make connections and advertise a lot of what our residents' specific interests are, both inside and outside the hospital, and encourage our applicants to reach out to them. And they're more than happy to answer any of those questions that you might have. We too do a second look in February. It is a non-evaluative second look. This year, I know for a limited number of programs, if I remember correctly, I think it's internal medicine, vascular surgery, and pediatrics. The NRMP is offering a program that is an opt-in and opt-out in terms of we will lock our program. So we will basically have a certification date for our rank order list that we mentioned earlier. We actually do commit to doing that before our second looks, but we actually opted out of the NRMP lock because our interviews go late into January, and it was going to really compress our timeline in terms of creating our rank order list. We wanted that's a crucial part of this entire process, and so we wanted to make sure that we had all the time that we needed to provide that due diligence around that. But we ensure that our rank order list will be certified and locked prior to our second look. So everyone who does choose to come, really truly knows that it is non-evaluative. And likewise, I do not, or anyone on the ranking committee does not see that RSVP list for the second look event. I actually don't know who's coming until the day of that second look event. So. And much the same as I think a lot of the programs, we offer a lot of virtual social events, and we also offer a virtual second look event as well. We know that for those of you who may not live near the Northeast, and with travel being as expensive as it is, we want to make sure that you have all those opportunities to engage with our trainees, and also even come back for a second look as well, even if you're not able to be here in person.
Excellent, excellent. So we're coming down to the straightaway here. I want to ask one final question that'll be maybe for two individuals to respond to before we have closing statements by everyone. So my final question, again, that many people ask from year to year is how disparate the advice is for whether or not after your interview, if you should send thank you letters to programs. So maybe if two people can talk about their thoughts on post-interview communication. Is this something you recommend?
I would say, do what feels genuine. It absolutely is not required. But I have received very thoughtful and genuine thank you notes, and I never want to, discourage that can be impactful. But the copy paste, the standard stuff, that's recognizable and it comes through, and it's not really going to help. So don't feel obligated to do it. Also, if you make a connection with someone you spoke with, it doesn't have to be the PD. A note to them also can have a lot of impact, right? It's all about relationships that you're trying to build, connections that you're trying to make or recognize. So just do what feels genuine. Don't feel obligated, and also don't necessarily expect a reply, or don't be flustered if you don't get a reply.
Excellent. Any other program wants to comment? So, Amler.
Yeah, I think in the interest of time, I will just highlight all of that. I think don't feel obligated to send anything. And definitely don't send the copy paste thing that pops up immediately after your interview is done. We can tell when that's not the case. But if there's, hey, I really enjoyed this conversation, and you wanted to talk further with somebody, one of your interviewers, I often get those sent to me from the interviewers themselves. This person was great. They thanked me, things like that. I will note that we try our best not to let that influence anything. So we don't put a checkbox in our Excel sheet or anything like that. There's nothing sent to letter. There's absolutely none of that. So don't feel like you're obligated to do so.
Excellent. Okay, and this is a little different also than the letter that might say you are my number one program. That is something that, number one, don't send it if it's not true. Do not do that. We talk to each other. That's just a bad look. But that's different than the immediate past. I enjoyed the conversation. The immediate past is something that I would say also, don't stress yourself. If it doesn't feel genuine, just don't do it. It does not really matter. Okay, I do want to leave everyone now maybe a minute to just give any final words of advice they have. You can summarize what you've already mentioned before or highlight something that maybe hasn't come up in the discussion today. But if we can do that, let's kind of start from the beginning. Dr. Nahed, want to go ahead and give a final comments?
Yeah, I think this is a great panel. It's always interesting on these panels to hear just the varied opinions, but I think all of us really are saying the same thing, which is this is such a wonderful time for you to showcase not only what you've done to get to the point of residency, but more importantly, why you're unique or interested in that one, and whether that's in the interview or not. The best advice I would get is just be you and really work as hard as you possibly can, and the rest will almost always work out. And I think so much of this is about learning about the insights from us. But remember, every time you're at a place, you're actually interviewing them at the same time that they're interviewing you. And a lot of it, regardless of the specialty, is how happy are people, how happy are the faculty, what's the interaction, what's the culture like, how do people do? And a lot of life happens during residency, and I always stress that. I hope each and all of you end up at one of our programs or in Boston, because I'll tell you, it's been the best experience of my life.
Excellent. Dr. Nevis?
Yeah, thank you so much. My advice to applicants always is to really do some personal reflection and find a place where you can feel comfortable being vulnerable. Training is a time where you are going to be vulnerable, fail at things, not be the best at things. And so it can be hard to break from that cycle up until now, right? It's always been about, the most prestigious place or the best place so that I can get into the best next step, or I can get to the best next step, right? Every anesthesia training program can result in board certification, in fellowship, in a very fulfilling career. And so what you need to focus on is a place where that you can feel comfortable not being your best self, because you won't be your best self right away in a lot of things. That's the first time. Training is the first time you see that in a lot of ways. And so that can be, a lot of programs can give you that support and can be the best for you without being, a top ranked place. So don't stress too much. Don't stress too much about that, and really look for that fit for you.
So thank you for that, Dr. Alamas.
I would say, residency is an amazing experience. It really is a formative experience that makes you the physician you're going to be. So I think you need to really look at programs hard, figure out what's the right fit for you, where you feel you have your people. So the peer learning is such a big part of residency, especially in internal medicine. And you want to make sure that you feel the residents that you're going to be working with, that you're going to be learning a lot, you're going to be enjoying spending time with them. They're going to become great friends because you'll be, a lot of difficult things happen during residency. You want to make sure you're with the right people. And I think the other thing I tell students that I advise is you also want to go to a program which not only feels right in terms of the people, but also that's going to stretch you a little bit. You want to become the best physician you can be. And I think going to a program that's going to provide that also will make it more interesting, fun, and help you grow as a physician. So as we look holistically at your application, look at us holistically as well. I think that's really important, and make sure you really are asking those tough questions to make sure it is the right match for you and what you want to do. But one of the most important things I think people lose sight of, they look at the programs, the resources, or the people. and the people really can make or break the experience. So really take a look at that.
Thank you so much, Dr. Young.
I'd like to echo those similar comments. The most common question I think all the program directors get is what's the strength in your program? And similarly, I think it's about the people. Obviously, we have amazing world-class academic medical centers, but it's really about the individuals that you work with and train with. And for applicants, you were invited to the interview for a reason. So you're qualified, you're meant to be there. So it's your opportunity to be as authentic and as genuine as possible and really highlight the things that are important to you. Don't try to figure out what's important to us because it might be something that's very unique and nuanced that helps you stand out that it'll be like, oh, wow, we didn't really notice that. So really, you don't need to highlight everything that you've published or presented. It could be a community engagement project, advocacy, policy work. So whatever is near and dear to your heart and a passion project for you, highlight that and just be yourself and have fun. This is an exciting time.
Send that to Umler.
Yeah, this is great to hear. I think a lot of us agree on this. Be you, present you. Don't dilute it too much. Don't try to get everything in there. Come up with a couple themes of who you are and what you've done and try to make those stand out throughout your application, your personal statement, your achievements throughout. Who are you? What have you done? What is your distance traveled? As others said, find your fit. Use this season to do so. Please, please, please feel comfortable asking questions that will help you do that. This is just as much, if not more so, you finding the program that fits for you. You know, I think about last year, I had a conversation with somebody, and I think in the middle of it, she realized she was talking about her like 20-year dancing career, and she felt like it was for too long, right? Oh, I should switch into medicine. And she's, oh, sorry, and started switching to medicine. I said, no, 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 please, like, let's talk about that. That's awesome. That's who you are. I have other people in the program that dance. Like, try to talk about you a little bit. And I just really recommend, I hope for all of you, you find a place where you feel comfortable that can get you where you want to be. Thanks for the time.
And Dr. Hastings.
Yeah, I think I would echo a lot of this wise advice, agree with it. And I think this experience, this time is really about you all. So I do think, sharing things about yourselves personally is going to be more memorable. The more memorable interviews are when you open up. And if we're making a decision to interview, it means we very likely would like you to train with us. So I think once you make it to the interview day, really, you are very much interviewing the program as much as we're interviewing you. And we want people that want to be with us, right? We don't want you to go somewhere at a program that you're not going to be feeling that we can meet your career goal needs or help you grow and thrive, because we really do want you to thrive in residency. So be yourselves, ask those tough questions. If the questions aren't answered on the interview day, I think it was a great piece of advice. Don't hesitate to reach out to residents and have a one-on-one conversation with them thereafter, or talk to us as well. And really look at a place where you feel that you'll find mentors among the residents and then also among the faculty, because that will really help you grow in your careers. And best of luck to everyone.
Well, thank you all for being here, spending your Saturdays to talk to our applicants and interested individuals on this call. I think I'm seeing some hands of some clapping hands here, but I hope that everybody found this helpful. I mean, the idea was that we're to talk about our programs, but really to talk about your process of applying to residency. It can feel daunting. As leaders, hopefully you're getting a little bit of the inside track on what it is we're looking for, but please be yourself. Make sure you have someone read your applications, and we're looking forward to reading those one-page personal statements. You all have a great rest of today listening to the residents who are coming up next. And please ask some of your specific program and specialty specific questions during these breakout sessions. Please take advantage of that time. And with that, I'll pass it back over to Dr. Landry.
All right. Thank you, Dennis, for that wonderful presentation. And again, thank you to the program directors for being here and taking your time out. And I know many of you are going to be sticking around for the sessions that we're doing for specialties. So thank you for being here and giving so much time to these prospective applicants. Up next is we're going to take a different perspective from this conversation. We're going to have the some trainees lead us in a discussion to hear about what's happening at the institution level, how they experience the application process, and also to talk about living, working, and playing in Boston. So it is my pleasure to introduce Dr. Phelan Dimses, who will be the moderator for the resident panel. Phelan is a vascular surgery resident in her 4th year at Mass General Hospital. She is an active member for the Center of Diversity and Inclusion Resident and Fellows Committee at Mass General, and also someone who has been on this panel before. And we're grateful that Phelan has taken the time out of her busy resident schedule to join us again and moderating this panel. So I will turn it over to you, Phelan.
Thank you so much, Dr. Landry. Hi, everyone. Again, nice to meet you all. We've kind of been in this space before if you've joined the residency like showcase in the past. So again, this is sort of a very open conversation that we're hoping you guys can lead with the questions that you have for us specifically. Just a little bit formatting wise, I'll introduce our panelists. I would love it if all of you can go around and just tell everybody where you're from, where you did med school. Maybe you'll find some friends on the chat here. And then after that, we'll start moderating the conversation. So first up, from Boston Children's Hospital, we have Brett Mitchell. He's one of our pediatric residents. Then from Brigham and Women's Hospital, Ashley Harriet is also joining us, and she's in the anesthesia department. And then from Mass General, which is where I'm at, we have Tylen Siwemuke. Nice to meet you. And then from Beth Israel Deaconess, we have Crystalline Bellamy. From Cambridge Health Alliance, Crystalline, you are pathology resident at BI. And then from Cambridge Health Alliance, we have Samantha McKnight, who's training in internal medicine. And then last but not least, from Mount Auburn Hospital, Marco Noriega, who's training in internal medicine as well. So we'll start with Brett. You're first on my list. Can you just tell everybody, where you went to medical school? You can add a fun fact or something.
Cool. Thank you for introducing me, and I'm grateful to be here to talk with applicants. And I am Brett. I'm initially from Atlanta, Georgia. I went to med school at Drexel in Philadelphia. And a fun fact about me is I have a lobster roll blog for lobster rolls in the New England area on Instagram. So, yeah.
Good thing that brings you out. All right, Samantha, you can go next.
Hi, everyone. It's so great to be here. My name is Samantha McKnight. I am a PGY2 at CHA. I went to medical school at Wright State in Dayton, Ohio. And a fun fact about me is I played field hockey in college.
Very cool. All right, Ashley, you're up.
Hi, everyone. My name's Ashley. I'm from Atlanta, like Brett. I went to Emory for medical school, and my fun fact is that I really love to travel, and I went to Iceland this summer.
Is it warm in the summer? Yeah, right?
Yeah, it's like 60s. Okay. It was in the middle.
Okay. Marco, you're up.
Hello, everyone. My name is Marco Noriega. I'm originally from the Arizona-Mexico border. I went to med school in Mexico and Guadalajara, and I've been in Boston for about 4 years now. Fun fact about me is that I have a second career in wine. So,
very cool. All right, Tylen.
Hey guys, really excited to be here. Like Brett and Ashley, I'm also from the Atlanta area in Georgia. I went to the Medical College of Georgia. I don't really have a fun fact. I would say this is the longest that I've lived outside of Georgia. So I'm excited to see what this first winter is like.
All right, Crystalline.
Hi, everyone. My name is Crystalline Bellamy. I'm a second-year pathology resident at Beth Israel Deaconess Medical Center. I'm originally from Miami, Florida. I went to Florida Atlantic University for undergrad. I double majored in biology and neuroscience, and then Meharry Medical College in Nashville, Tennessee for my medical degree. Oh, fun fact, I used to play rugby in college.
Cool. All right. Well, I'm from Los Angeles, so I think like unanimously, none of us are actually from the Boston area. And originally from Los Angeles, I went to undergrad at BC, like my intro said, and then I see some Geisel Dartmouth students who are on the call as well. So that's where I went to medical school. Yeah. Okay, so I'll start with asking a question, and I'll pick maybe one or two of you to answer, and then if anyone else really has something to add to the conversation, we can have you join. Please ask us questions, because I think it's more valuable if we're answering your questions than me asking these questions, but they're pretty good questions, I think. So hopefully they kind of capture what you wanted to get out of this call. Also, I love when the videos are on, because I like pretend I can see you all. So if you're comfortable, turn it on. Okay. All right. So first thing, I will start with Samantha. Tell us something that you wish you knew before applying into your residency program. Something that you would tell your, MS3, MS4 self.
Good question. To be completely honest, I would tell myself to relax, honestly, and that everything is going to happen the way it should happen. I think that there's so much pressure and there's so much unknown, but I would really just tell myself to trust myself, and know that after I've done my homework, after I presented myself the best way I can, that things are going to work out for the best.
Okay. Thank you. Tylen, what about you?
Yeah, I think I definitely tell myself just give yourself a little bit of grace. This process is certainly daunting. I think there are a lot of moments along the path, that's specifically as it relates to applying to residency, where you might, get a little maybe fed up with the waiting process. But everyone I met along the way is super helpful and super um, nice and genuine. So just find the place where you feel the most at home, and try to learn and meet as many people and make as many connections as possible.
Okay, thank you. What is something that, let's say, Marco, will go with you next, something about your residency program that surprised you, kind of in a positive way, or maybe surprised you in a not so positive way?
Yeah, I think one of the most surprising things, I grew up in a multi-language community, and I did have the experience of working in other hospitals here in the US. And when I came to my hospital, I was really surprised how many languages my colleagues speak. So in my residency program, there's around 17 second language speakers, like second variety of languages. So we speak around 80% of the second languages in the US. So it was very interesting to see us like say good morning to each other in our own languages and that sort of perspective. So it really talks to the population we serve. So you see that our coworkers are actually reflected in our community. So that's something that was very surprising, that it's very difficult to perceive during the interview process. And I think that my advice would be that those resident meet and greets sort of will reflect a little bit of that experience that can be really surprising once you're actually working in the hospital.
Yeah, that's actually a really excellent point, because I'm sure a lot of you who are not from Boston have heard about Boston, that it's not very diverse. There's not a lot of Black people in Boston. It's not very true. I think you'll see it in not only the patient population that you care for, but also within the city itself. It's just sort of, you have to go around and find different communities. Brett, what about you?
Yeah, I would say that, while residency certainly is a lot of work, long hours that you'll spend, but uh, one thing that drew me to the program that I chose was how social people were, and how you will be able to find time to take care of yourself, like plenty of time to take care of yourself and do things that you love. And I've been able to, take day trips on the weekend to different places in New England, explore Boston, with not only myself or other people in the program. And that's just been, something that has been beneficial to like help with your or my mental health and others, to make sure that you're having fun on the side as well as being a resident. So that's been something that's been like a very pleasant sort of surprise with like how much time I've been able to do things in the city.
You can always count on the pediatric residents to like remind us to like enjoy life, and to have fun. So I really love that. Thank you. All right, what about you, Ashley?
I think maybe just like how kind people have been in a great way. Like it's been so lovely to have met everyone very virtually and then come in and just see like all of the the vibes that I felt virtually were true, and people are just so welcoming, and it makes the 24-hour shifts a lot easier. And I think maybe what surprised me the most was I felt like the anesthesia department was going to be great and the people would be lovely, but beyond anesthesia, like as a medicine resident last year, people were also just so great, so down to teach all the time. Yeah, and that's just been very surprising in the best way.
That's awesome. Okay. I think now I kind of want to ask a little bit more about like what residency life has been like for you. You kind of alluded to 24-hour shifts and like long calls and things like that. And every program looks a bit different. But why doesn't someone sort of volunteer and take this one first? Crystalline, what about you? Pathology, start us easy.
Yes. Residency life has been an adjustment. It has been hours, hours of kind of like finding a new flow because you have your flow in medical school, you know what works for you and you know your learning style, but then you have to readjust in residency, I feel like, to accommodate the hours and all the new information that you're receiving. So it has been an adjustment for me in that aspect, but I have also found grounding in the faculty and in my co-residents, and I've been able to bridge a whole nother community. And so, yeah, as far as the experience goes, like it's invaluable. I've had a great experience so far.
I'm glad to hear that. All right, Tylen, I know you spent some time on surgery, so you have permission to talk about it.
Yeah, so I actually so first year anesthesia resident, so we kind of go through all of the different services. And I think the thing that I have enjoyed the most is, as others have kind of alluded to at their respective hospitals, is how willing everyone is to kind of take you into their team and how willing they are to teach you. Um, by no means are we experts, especially as interns. If we were, then we wouldn't need residency. So I've been learning a lot, and I've also been surprising myself how much you can learn in such a small amount of time. But I think, you know, at the end of the day, they have this saying at MGH: never worry alone. And we take care of some really sick patients. And I think, you know, at the end of the day, in the middle of the day, at the beginning of the day, I'm always worried about how my patients will do. But I think beyond just the learning, I am just amazed by how much everyone cares about these patients. It's more than just pathology. They are like humans. So it makes kind of the hours worth it when we are able to have some really good outcomes and we are able to do some learning and have some collegiality amongst, you know, my time in different services. So it's been tough, but I've been enjoying it a lot.
Yeah, and you know, I'm sure that resonates with a lot of us on the call right now. As a vascular surgery resident, so we have like an integrated program. So we spend half of our time, the first 3 years, on surgery, and then we kind of start specializing more concretely in vascular surgery as it goes on. To that point, I would say, like, as you're thinking about residency programs, and you know that you spend time on other services as part of that program, I think like interventional radiology does this, and you know there's a bunch of other specialties that do a year with or spend time during their residency with other services. You want to make sure you find some place that has strong, you know, representation along multiple, you know, because you can have a really good like pathology residency, but if the medicine residency is not as great, you know, your time on that service or even just like engaging with those colleagues will not be as positive. And so that was really important for me. And I think the beauty of MGH has been that like it offers all of those things. And so that's been really valuable. I will say the hours are long. I'm not gonna lie to you. The hours are very long, but it's temporary. Like everything, you know, now I'm on academic development, like, you know, I'm drinking water, my skin is healthy. Like it's just better. It's just a lot better. But you know, there are times where you kind of like you have to, you know, pay your dues and you like Talon brought up, it's really about taking care of the patients and doing right by the patients. And so that's not something, we're not in a clock in, clock out profession. So you really get to appreciate that in residency. And also find like the work-life balance. So to that point, we already learned about, you know, lobster rolls. What are some things that you guys have found in Boston so far? And some folks have been here a couple more years than others, but like, what are some things that you found that you enjoy in the city of Boston, or I guess the surrounding neighborhoods? But let's try to stay in Boston because it's like so tempting to be like, I go to New Hampshire to ski. Who wants to start us off? If you really have something. Oh yeah, Crystal.
I can take that one. I'm from Miami, so the city is not walkable. We don't have well, we have public transportation, but it's not as efficient. So I was really surprised by how much I enjoyed like greenery and nature, and there's parks every other block. I really enjoyed that. It's good to come out of a difficult case or a difficult sign out, which was like rounds for us with an attending, and just be able to decompress, like go for a walk. And so yeah, that's something that was surprising that I didn't think I needed, but it's been a good self-care ritual for me.
That is a really good point. I like that. Ashley, I feel like you have something that you want to tell us about.
I was actually in Boston for undergrad. I was at Harvard. So this is now my 6th year in Boston with a little gap being at Emory for med school. I feel like being from Atlanta, there's not really any water around. So that's always been one of my favorite things about Boston is the Charles River, and like the beaches are so close by. So during the summer, it's really nice to go to the beach. It's really easy to get there because you can take the train.
I love that. It's like always such an interesting adjustment for me when people say they go to the beach in Boston because I'm from LA and I'm like, I don't know about that. But there are some really nice beaches to that
Not
point.
all of us have that luxury.
Fair enough, fair enough. All right, what about you, Marco?
I think I have to second Ashley because I'm from the desert, so I love the water and all the water sports. So I really enjoy going out kayaking. There's sailing, there's rowing. So if you don't want to go to the beach, you can try the river, and I think it's pretty great. So some people swim in the Charles. I would not do that personally, but I think that the water experiences here in Boston. And then for those that have very good balance and core, you can go ice skating, which is pretty great.
Great point. And it's like a city that you can find people running like in all weathers. My dad is like a marathon runner, and so he loves that about the city. It's like it can be snowing, it could be, there could be a hurricane in Boston. People are still going to get their running, and it's admirable to say the least. Okay, I'll kind of pause here to see if anybody wanted to raise their hand and ask a question, wanted clarification on anything we've answered so far. Otherwise, I can keep going with my questions. All right, I'm gonna keep going. Samantha, this question is for you to start us off with. Tell me a little bit about how you've gone about finding mentors and people to like support you within your residency program.
Good question. I kind of had an eye on different faculty before I even got to my program. I think that was a big part of why I went there. It was important for me to find mentors that looked like me and had journeys similar to mine. So I definitely looked at some of the things that people were involved in. And I've also been very fortunate. One of the things that my program offers is assigned mentors, people that are not faculty, but just involved with my institution. And it's very nice because, they're not people that have any involvement in evaluating us, and we can kind of be a little bit more open about any struggles or hardships that we've had. And also just being in Massachusetts itself, there's just it's such a wide network of people and so many great networking opportunities. So I think mentorship is a great thing that you can find here.
Thank you. Thank you for starting us off. I'll go next to, let's see, Crystalline, do you want to take this one on?
Sure. My answer is going to be similar to Samantha's. I did know of a few faculty members that I eventually want to subspecialize in breast pathology. So I knew the faculty members, there was a good breast fellowship program, and that kind of guided my decision. But we are also assigned mentors in pathology residency that we kind of that share our interests, but also look at us as whole people. So I have faculty mentors that are involved in research, are involved in community service activities because I'm very big in community service. And so there's like a mentor for everything that I want to do eventually. But our program is very good about just walking up and asking, like if we want a project, a research project, or we need help in something, there's an open door policy. You can literally just knock, and everyone is generally very helpful.
Yeah. What about you, Brett? What is it like at Boston Children's?
Yeah, I would echo everything everyone said so far. And for me, it's been through just how, again, with pediatricians being very nice people, if you hear about a project someone like an attending or a fellow is doing, and you hear like a noon conference talk about a topic, people have been very receptive to hear about your interest in that. And I've like had some organic relationships come up about like me being interested in doing a project or like asking, a chief, I'm interested in this. Like, do you know any faculty who um, do work in that field? And that's something that has like led to me like working with faculty to help with some curricular development projects that I've been a part of, and also some other research things. So I feel like just people like just knowing everyone within the hospital and the program and connecting you to those who they know share your similar interests has just been very helpful so far. And so that's been my experience.
I'm so glad to hear. Talon, I know you're starting off in your intern year, but tell us what your experience has been like, because I know the anesthesia department is very intentional about that.
Yeah, thank you. I'm like I really appreciate this question because they are very intentional. It is difficult to think about life outside of intern year as you're going through it, especially as you're starting off. But we also have sort of a formal mentorship program where we get a faculty, and then it goes through each of the PGY years as well. So I have an immediate PGY two who I feel like maybe 2 or 3 days after we matched, reached out to me and said, "Hey, I'm going to be in your family. If you have any questions about moving or once you get here, if you need any assistance with anything." So that's a relationship. And then the faculty mentor that I have, he like is consistently reaching out to me. He kind of I'm assuming has like my schedule, and he's like, "Oh, I see you're on ICU. Like, how are things going?" And then he also is asking me about sort of my plans or what I think I'm interested in for fellowship or community service or research, and he's kind of helping me think about who would be a good person to reach out to based on my interests. So they're very intentional about it. Even I would say before I was thinking about it myself, it seems like these are the things that they are attempting to put together. So I'm really grateful for the network that's already been established for us here.
So happy to hear that. Anyone else want to chime in from their specific programs? I think what I can say, I remember when I was in your guys' shoes, because I attended this showcase when I was a medical student as well, and I believe it was in person at the time. But I remember someone sort of characterizing it as like a lot of the Harvard affiliated residency programs. I think this probably remains true for most of the programs. There's like people available, maybe unique to surgery, but there's like people available to support you in anything that you want to do. You have to be like courageous in asking for that help, and being very specific about your ask, and being prepared to like actually see it through. So if it's like, oh, I want to do a research project, okay, like what do you want to do? What do you want to do research in? What do who are you interested in working with? Have you looked up people? Once you've done that groundwork, like people will see you through and will make sure that you're connected to the right people. I've had literally the chair of our department, the former chair of our department, send emails to people asking them to help me with specific things. And so that only happens if you're kind of naming what your needs are, and then kind of following through and making sure you're showing up at meetings and doing all of those things. It's not, I don't think if you're someone who like needs a little bit more support to like initiate something, I think it'll be a little bit challenging for you to like navigate some of our residency programs. But if you're kind of, you can start that initial self-motivation piece of it, I think you'll have a lot of success within. I don't know if that's a fair statement. I'm seeing some heads nod and okay, thank you, Mark. Thanks, Ash. Okay, awesome. Okay, again, pausing because I really want to hear your guys' questions. Oh, yay, Elena. Hey, familiar face. How's it going?
Good. How are you? It's so good to see you, Fallon. Yeah, just because I have to do this for everyone on the call, Fallon's and like an absolute force of nature and a Geisel grad we're really proud of. So I had to call you out in the chat. You're welcome for embarrassing you. But yeah, I was just curious. I think, you know, moving forward, there's something to be said about figuring out what you don't know. And one of the questions that I kind of have is like, what do you wish you would have asked going through, right, your application process, whether it was of program directors, other residents, like what are the questions where you kind of looked back, especially like later on in the process and thought about, oh, that's actually something that I really value, or people might not think to ask about this early on.
Oh, that's awesome. Does anyone have a response for her? I'm happy to start if not. You know, one thing that during residency interviews that I started asking like midway through the process, because I realized like this is important. You know, you have like the questions, like you always should have questions ready, you know, when you get to the interview process. It's like as much as it's, you know, like everyone always asks and you've had like 15-30 minutes to like talk about yourself, you always want to be prepared with that aspect. And I started asking about like specifics about things that residents have said they don't like about a program and what like was done, like a very actionable like question to tell you something about like what does it look like for residents to have like, you know, because every residency program is going to have like, you know, critiques of their residency. So what does it look like for residents to speak up and how do they feel heard? Like, what are the responses? So then being able to give you like actionable, like for us, there was like a specific rotation that like didn't make sense, added another 12-hour shift for the consult resident, like, you know what I mean? And so they talked about how like residents brought that up for many years and eventually they like switched up the format. So it's, you know, it's okay if like solutions take time to happen, but I think you want to hear that like someone is there and resonates with the issues that residents bring up. So I remember that's like something I would say that like if I had done that maybe early on, it would have given me a better sense of some programs.
Great. Thank you so much. Yeah. Does anyone else have anything to add? I know you're moderating, not me.
I can also like piggyback on that and also just reaching out to residents one-on-one and asking these questions because, you know, we maintain a level of professionalism on interview day, not saying, you know, lying or anything like that, but it's just a level of professionalism. And I think off that, you can really ask certain questions that maybe residents would be embarrassed to answer or maybe wouldn't feel comfortable answering 100% kind of offline. And you can ask those more specific questions to them and get more maybe direct responses to what you really want to know. I would just offer that advice.
That is exactly what I was going to say. It's not really a question, but more something that I also started doing about halfway through my interview season was being more intentional about reaching out to residents one-on-one, especially like you'll meet a lot of residents during like the social like Zoom meeting the night before your interview and just like make a list of people who you feel like you might get along with and would like to ask more questions to. And I feel like those conversations with residents one-on-one was really helpful with making like my final rank list and figuring out where I felt like I'd fit in best.
Absolutely. Well, thank you guys so much. I really appreciate you taking the time and giving us all some advice.
Thank you, Elena. I think Leela, you were next. And Nicholas, I see your question.
Thanks so much. I appreciate you hosting this session. We were asked to ask some challenging questions, so I hope this is okay to ask. Could we dig in a little bit to the question of affordability, particularly in Boston? And I think this applies to a lot of cities where major academic medical centers, especially some of the best academic medical centers, are based. And transitioning to living in those cities, and what kind of supports you saw it, or how you guys made it work, basically.
Yeah, no, that's an excellent question. I mean, it's true for many programs. Boston is a beautiful city, but it is not a cheap city. So I want to point at someone to take this on first.
I can answer it first.
Oh, you were ready.
Yeah. So like, no secret that Boston is super expensive, and so Boston residents, just from like a base salary standpoint, like are paid more than other residents who live in like cities that are lower cost of living just in general. But so that's something that programs have done. I can't speak for other institutions, but at least the Boston Children's residents do get a housing stipend that does help with the cost of living. But for me personally, I have like non-negotiables where, coming from the South, I want to have my central air, I need a dishwasher and washer and dryer. And so to get all of those things, I did sacrifice a little bit of like location, as far as like not being like directly in the hustle and bustle of the city, like compared to where some of my other co-residents live. I live in Roxbury, which is a historically Black neighborhood, but it's like the cost of living is cheaper based on like what I wanted to have. And I live in a relatively new building, and it is something that is affordable, given that I have a partner as well who helps pay the rent. So that's something that was helpful for me. I'm not sure if someone who may live by themselves has a different perspective, but generally programs are aware that it's very expensive here, and they do at least try and levy some of that with the salary and some of the stipends they give us.
Yeah, that's very much true for the MGB, like Mass General Brigham programs as well. So one, we also have a housing stipend that you get every year. There's like a second one that may or may not be continuing, but was through what is now the Office of Enrichment and Engagement. And so that was like an additional second like housing stipend as well. Both were $10,000 pre-tax, y'all, pre-tax. So post-tax a little less, but nonetheless. And I think their MGB also like is, the residents are unionized, and so there's like salary protection. There's like salary increases incrementally at every PGY year, even during your research years. So there's like some benefits that have kind of been pulled out of that as well. So there are supports. And then the residents who are leaving, like graduating, do a good job of like letting people know about their like, their apartments or whatever, so you can take over leases and try to keep things like rent within like an affordable amount. I can tell you, I'm a surgery resident. I live across the street from the hospital, but not like literally across the street. I'm like a little ways away, but like a 7-minute walk. And that's because like I have to be there early for me to think about traffic and driving in from outside of, this like zip code. Just, it's very stressful for me. I'd just rather not. So if I can be walking distance, that works for me. But it like obviously comes with the sacrifice of, I can only go out to brunch like once a month. I don't know, like, maybe. So yeah, a lot of these questions we can probably also capture in the breakout rooms if we don't get to it. Sorry, we are like running close on time. Anjali, go ahead.
Hi, thank you guys so much for being here. So my question is, it's great to see that it seems like everyone's geographically from all over. Like as someone who's like based out of the East Coast, but medical school is more Midwest, I was wondering from your all perspective, kind of how you got your foot in the door for these affiliated programs, how you got your foot in the door for like Boston as a city, if it was like students from your own medical school or residents or faculty that helped you through this process.
I think it's always helpful to know, former students from your medical school program who are currently within that residency. I think, my understanding, at least of our program, is that our program director really trusts the people that she's already recruited as residents to her program. And so if we can then vouch for the next person that's, considering our residency program, it like carries a lot of weight. I mean, you have to have like an outstanding application. It's not like I can't, vouch for everyone equally, but my point being, I think that it does carry a lot of meaning to our program, to be able to say, like, we know this person in this context, and this is some of the work that they've done, and I think they'd be a great addition. So I think having that connection is always helpful, but it's not like absolute, like, I don't know how many of you on this call knew people in the program already, but I think, one, I don't think anyone is looking for you to have a connection to Boston necessarily. I think if you're a good fit for that residency program, like that's going to be the thing that sort of champions all the other kind of logistical things. Like yes, it would be great if, you live close to your family who also lives in like Jamaica Plain or Roxbury or something like that, but that wouldn't be the qualifier necessarily. So don't count yourself out just because you're from, like, we all just named places that are not Boston. I think some of us went to like undergrad in Boston, but certainly not connected I was not connected to Mass General at all before I applied to residency there. I will briefly go to Nicholas's question, sorry. Unless anyone else has more to add, and we can chat more in our breakout rooms. Sorry, I know I have like 3 minutes. So you asked, do trainees generally have a voice in shaping their education / voicing concerns in the Harvard system? Like, is the relation between leadership and trainees generally constructive and aligned? Yeah, that's a great question. Oh, thank you. We've already had some responses to it. So if you're asking within the Harvard system, like Harvard, like medical school or at large, I think that response I would agree with. But I think if it's in terms of within our specific residency programs, I think we feel pretty heard. And within our residency program, I would say, is like the surgical residents, there's a lot of things that we want to like change about the program that are not able to be changed because there's like things that are also logistical and beyond like what impacts us that impacts other people, like advanced care providers and everyone else. So everything is not always perfect, but I think we are certainly like at the table being part of the conversation, and decisions are not coming down top down typically. Let's have Marco, if you want to say a word or two about your program. And
yeah, thanks for giving me a little bit of time to give my perspective on that. And one thing that I would say, and I've had experience in the Harvard graduate programs as well. So the city, and I'd say Harvard itself as an institution, as you've seen in the news, provides a culture of open dialogue. And I think that the feedback culture around here is a very healthy feedback culture. It is very well expected for everyone to voice their opinions and their perspectives as a personal sort of way of expression, and people don't take things personal. So it just creates an environment where we're all sort of trying to be accountable with our actions, and just a culture of improvement and safety for our patients when it comes from the medical perspective. And you'll see it in academia, you'll see it everywhere. It's a lot of respect, a lot of collegiality, but it is a very positive feedback culture when it comes to the Harvard institutions and the hospitals around the area.
Yeah, I would echo that as well. Thank you. That was a great response. Okay, I think that makes our time. Ooh, I'm on time. Christopher, I know we didn't get to your question. I hope you have a chance to ask it in the breakout rooms. Otherwise, I'll just add my contact information and you can reach out to me.
All right. Well, I will take over here. I want to say thank you to all of the residents for joining us. The fact that you gave up your Saturday afternoon when you could have been doing something amazing like Phelan and her brunch opportunities that she loves to take part of. Thank you for being here and thank you for moderating the program, Phelan. We're really excited to have so many people to join us and be a part of this discussion thus far. Right now is a chance for us to pivot and do something that will allow you to hear more specifically about the specialties that you're applying into. Just a couple of housekeeping notes when it comes to these sessions. They're going to start now and they're going to go until about 4 o'clock. You have the option of joining the group that is located on the bottom of your screen. If you don't see it, click more, then it should appear on the menu, and you are free to choose whatever group you would like to join. The list of groups being offered is listed by field, so you'll see that in the room. Just scroll down and you will see the name of the group you would like to join. Um, Sometimes there are multiple groups offered. Join the one, especially if you're in some of these larger specialties with a large number of people registered for the program, number one, and then also registered for this event. So we do have them broken down by last name. So look at psychiatry. A through G will be in one group. H through M for the last name. Your last name letters starting with letters H through M will be in another group, and then the last group will be N through Z. So you can see that we do this for a handful of specialties just for the size. Um, for the interest and for the appreciation of the people that are hosting the sessions, the breakout sessions, please have your camera on. Please chat with them directly. That way, you can interact with them and make it for a more warm, natural feeling, even though we are on a virtual space. And if for some reason you have any issues, you can always return to the main breakout space and we can try and answer any technical questions that you have. So I want to say that before we head out, I want to give a huge thank you to Lynn Fulton John, who helped to organize this program. She's an amazing person I've had the pleasure of working with for many years, and you did a wonderful job executing our virtual showcase. I want to say thank you to Zach Whitman, who has been behind the scenes as well from HMS. Also want to say again, thank you to Dr. Joan Reed, the leader of our Office for our Office for Culture and Community Engagement. And last but not least, all the representatives from the hospitals, be it their individuals here for the welcome to the program directors, as well as the trainees and other staff that are here. So with that, please find your breakout room, take the next hour to ask those tough questions. And thank you for joining us this afternoon for the Harvard Affiliated Residency Program Showcase. Everyone have a good afternoon.